Good evening. You can probably hear me without the mic, but I'll go ahead and use it. Want to welcome you to the first of 5 meetings we're going to be having around the county for our County of Lake Community Visioning Forums and Community Health and Wellness, working together to rebuild resilient communities. When we started having our forums before, our visioning forums that we had right here in this building about the county's future economically, it was also in the back of our minds of the county and of all of our partners in the county to talk about a resilient, healthy, and really well-minded community. And this is going to be the beginning of that. There's a lot of information out there, I think, that is collected and maybe sent into our counties. I think there was just a report that came out. I can't think of the Woods report that came out, putting us number 58 of 58 unhealthy counties. And what we want to do is start to really, which I feel is important, to tell our story, to tell really what's going on in Lake County. And I know all the professionals here today on the panel will talk about the steps we've made forward here in the last few years, even with the devastating disasters that we've been incurring each year. And hopefully this year, knock on wood, we'll get through one without one. Looking at the overall wellness of our community as one of our visioning points also, the health and welfare of each home in this county is very important. You know, to make sure the kids go to bed with full stomachs is one of the things we're always reaching towards, and also making sure that they have a home over the roof over their head, so when they go to school, they're in the right mindset to be learning at their highest ability. So today we're going to talk about some of the opportunities and things that are going on throughout the Lake County with us, the county, and also some of our local health and wellness partners. And so I just want to welcome you to the first of our meetings that we're going to have throughout the next couple of months here in the county, one in each district, starting with District 1. So welcome and have a good evening. Please ask questions so we can get information out there. I know the folks online or on Facebook that we're live streaming to, please pay attention to what's being said. If you can't attend this one, please get to a face-to-face meeting. I do enjoy that face-to-face contact. Not Facebook so much, but I know it's a big part of our lives, and it's a way we get our message out there to everybody that can't attend. So thank you very much for coming to the Twin Pine Event Center today for our first of the community meetings. Welcome and thank you.
Thank you, Supervisor Simon. I am Denise Pomeroy. I am the Director of the Health Department here for the County of Lake, and we're going to be going through a little presentation for you today regarding Lake County and health and wellness. We have a wide variety of our partners here today who are also going to be talking with you about positive things that they've been doing in the last year and what's coming up for their agencies that are making a change and making a difference in our community. We want to encourage you to please ask questions. We have a mic set up at the end. We will be asking some questions of you, and then we also want your feedback. We want to hear from you. We want to know what you need to be healthier and what you need in your community to be healthier, okay? So I'd like to quickly introduce the panel, and I'm going to forget some of their names, but Dan Peterson, the CEO of Sutter Hospital, Dr. Aaron Gustafson, the Public Health Officer, Crystal Marketan, the Department of Social Services Director. That's it. Robin Barra, sorry, she's, I didn't write it down, I'm sorry, Robin. Todd Metcalfe, he is our Behavioral Health Administrator. Supervisor Moke. Russ Purdock from Adventist Health. Carla Ritz, our First 5 Executive Director. Brock Falkenberg, our Superintendent of Schools. Alison Piniella, who is the new Executive Director of Hope Rising, and Carol Hutchinson, our County CAO Administrator. So these people care about our community, they care about you, they care about our county, and they're going to be here to answer questions for you at the end, okay? So we'll go ahead and start the presentation. So why are we here today? We're here today to work for the community partners that will share to improve health and wellness in Lake County. This includes having an open conversation with our community to hear from you, to hear what is important to you regarding health and wellness. The information that we receive over the next 5 meetings will help us with our community health improvement plan. We currently have just gone through our community health needs assessment, and that will be coming out in the next month or two. And after that, we do these forums. We want to hear your voice so that we can take that voice and add it to the improvement plan. This will also help with public health accreditation, which is a program that the Public Health Department is currently working on, and over time to improve the community health profiles that you come out from the health rankings. So today, we want to hear your voice. So the history of health and wellness, Lake County routinely is in the bottom 10 counties from the county health rankings. That's Robert Wood Johnson Foundation, and the county health status profile that's presented every year from the California Department of Public Health. We're here today to discuss how we're going to improve that. What are we going to do to take those steps to help us be better as a community? And community health is different than individual health. Community health looks at all of the pieces of the puzzle that have an impact on health and wellness, not just my clinical piece, not just me taking my medication or me eating healthy or having nutrition. It looks at all of it. And part of that is Hope Rising. Along with the community partners, they'll have an important role in moving that dial for our community and making us healthy and well. So at this time, I'd like to have, where'd she go? Alison come up. She's going to talk to you a little bit about Hope Rising and how that's going to help our community.
Hi, everyone. Thanks for coming out tonight. My name's Alison Piniella, and I'm the Executive Director for Hope Rising Lake County. Hope Rising Lake County has been gathering, started convening a little over 3 years ago, talking about how to make Lake County a healthier place for its community members to not only engage and live, but to thrive. So we are an accountable community for healthcare. We believe that through only working together can we achieve our goals to make Lake County a better place to live for our community members. We've started a couple of programs in Lake County, some you may have heard of, one being SafeRx Lake County. It's an opioid reduction initiative. Collectively, with cross-sector agencies, we've been able to reduce our opioid prescription rates by 74% in Lake County. We've received a grant to open up a transitional housing for 20 community members in Clear Lake called the Hope Center. We host an annual innovation summit where we address things like housing and homelessness and opioid prescription rates. This year we'll be discussing and working on how to build resiliency in our community. And currently we're also working on doing our community health needs assessment, which is done every 3 years in our community. Anywho, it's been a pleasure to be here tonight, and I hope that you bring your questions and we're able to work collectively together over the years moving forward. Thank you.
Thank you, Allison. So, why should we invest in our community? What does that mean to us? So, investing in your community, for a lot of people, they often underestimate the non-healthcare related factors that affect community health. There are really only 4 steps that have been identified to improve health and well-being in communities. So here are the pieces. We need to know what affects health. 30% of what affects overall health is your health behaviors. That's what we call individual health. That's me taking care of me, or me taking care of my child. That's going to the doctor, getting preventative screenings, eating healthy, exercising, all of those things. But out of a big puzzle of 100%, 30% is not very much. So what are those other factors? Well, 10% of it's physical environment, so clean air, clean water, healthy, good, safe sidewalks, things that are in the environment that help us feel safe and secure when we're outside. 20% is clinical care, so those are your doctors and your access to care, your specialty care, and all of your medical providers. And then 40%, which is the biggest piece, is the social economic factors of health. And that's education, economic factors, employment, fair wages, good health insurance, family and social activities that support a safe community, and insecurities in any of these factors can lead to an unhealthy community and impact your overall health. The next piece is we need to focus on the area of great need. So population health encompasses the underlying factors driving social determinants of health, including community, infrastructure, violence, safety, education, family and social supports, food insecurity, nutrition, housing instability, and homelessness. Profound health disparities can decrease a person's life expectancy up to 15 years. So sometimes in health, as you can see here, it's not about your genetic zip code, it's about your actual zip code, where you live, and what's going on in that community to help increase your community and wellness. Why the partners are here today: collaborate with others to maximize efforts. One of the things that Hope Rising is doing as a community, and many of the people that are sitting up here before you are on their governing board, is bringing these agencies together to work on things as a whole, so that we are not, so that we're working together as identified priorities in a collaborative, cohesive, integrated, comprehensive approach to health. We're trying to break down the silos and become a more resilient community through our partnerships. Working together, we can build resilient communities in Lake County. And there's a use of a variety of interventions for the greatest impact. Action in any one of these areas may produce positive outcomes in another area. So when the county puts in new sidewalks that are ADA compliant, that can have an indirect overall help to community health. It also has a direct impact for individual health, as it allows people to get out and exercise and walk and feel safe where they're not walking on a road. Increasing investment in social economic factors can have the greatest impact on health and well-being for all of Lake County. And so you can see we have some of our bigger roadmaps down here, but it takes all 4 of these steps in order to invest in our community and make a healthier Lake County. So this next slide that I'm going to show you demonstrates how everyone can impact community health and wellness. When we work together, we can make a difference. We can tell our story, and we can improve health and wellness in Lake County. So there are the people of Lake County, and the governance of Lake County, and the elected officials, I can't read my slide, sorry. Oh, the education, the community partners, and then the medical. So when you see all of these pieces that make up our community and our county, you can see how we all interconnect with each other, and how everything that everybody does has an impact on somebody else. That's community health. So, like I said before, community health is more than just healthcare. It's bigger than just going to the doctor. It's bigger than just having a medical provider. It's a wide range of factors that influence how long and how well we live. It includes education and income, what we eat, exercise, quality of our housing, the safety of our neighborhoods, social determinants of health inequities. Public health is community-based, while hospitals and clinics are individual-based, and the county and the community partners impact the social, economic, and environmental factors. It takes all of us working together to improve Lake County's community health and wellness. So while we know that the health rankings came out a few weeks ago, and yes, Lake County was in the bottom 10 again, despite that, we've made some really good improvements. And those are what the things we need to look at and focus. The percentage of uninsured people has decreased from 20% to 9% since 2013. This year, 91% of the population and the people of Lake County had health insurance. We have some of the best air quality in the nation. We all know that. It provides that opportunity for healthy outdoor activities. Adult obesity decreased 2% since 2013. We are looking at how this relates to the nutrition program that was brought into the county in 2013. The SNAP-Ed program, which is across multiple organizations, including the Health Department, Department of Social Services, Lake County Lake Resource Center. And every one of us are picking a different piece of the population to work with. So the Health Department is picking the children in the schools. Lake Family Resource is doing, seniors and other and church-based. It's too soon yet to tell if this has a direct impact on this 2% decrease, but any decrease in obesity in our community is a good thing. Unemployment rates have improved over the past several years. They've decreased from 15% in 2009 to 6% in 2017. This has a direct impact on our social economic factors in our community, as when people have jobs, they feel better, they work better, and they can be healthier. They can provide for their families. At this point, I'm going to turn it over to Dr. Gustafson, who's going to come up and talk about the health impact pyramid.
Good evening. Relating to the earlier discussion on the factors that affect health, 40% socioeconomic, 30% health behaviors, 20% clinical care, and about 10% physical environment is the health impact pyramid. The health impact pyramid is proposed by Dr. Thomas Frieden, former director of the CDC. In this framework, efforts to address socioeconomic development are at the base of the pyramid, followed by public health interventions that change the context to make people's default decisions healthy, protective interventions with long-term benefits such as immunizations, direct clinical care, and at the top, counseling and education. In general, interventions represented at the base of the pyramid require less individual effort and have the greatest population impact. However, they may be more controversial, especially if the public does not see these interventions as being part of the government's role. Interventions at the top of the pyramid are designed to help individuals rather than entire populations, but could have a large population impact if universally and effectively applied. However, even the best programs at the pyramid's higher levels achieve limited public health impact, primarily because of their dependence on long-term individual behavioral change. Jeffrey Rose, an epidemiologist who authored Rose's Strategy of Preventive Medicine, wrote, "Personal lifestyle is socially conditioned. It makes little sense to expect individuals to behave differently than their peers. It is more appropriate to seek a general change in behavioral norms and in the circumstances with which facilitate their adoption." We did have some positive progress in areas in the 2019 CDPH, which is the California Department of Public Health County Health Status Profiles. The age-adjusted death rates for certain conditions decreased. These are average age-adjusted death rates from 2012 to 2014 compared to 2015 to 2017. And the death rate decreased from drug-induced deaths from 43.6 to 40.4 in 2015 to 2017. We saw the Alzheimer's rate of death decrease from 29.8 to 26.5. The age-adjusted death rate from lung cancer decreased from 56.2 to 46.7. The death rate from coronary heart disease decreased from 130.7 to 105.7. The age-adjusted death rate from chronic lower respiratory disease decreased from 67.6 to 58.6. We also had some positive progress in areas related to maternal and the health of children. The percent of pregnant women receiving adequate or adequate plus prenatal care, which was a 3-year average, increased from 64.4% to 68.5%. The age-specific birth rates to adolescent mothers, which were 15 to 19 years old, a 3-year average decreased from 35 per 1,000 female population to 28.5, which was a good decrease. The percent low birth weight infants decreased from 6.8% to 6.1%. And I will turn it back over to Denise.
Thank you, Dr. Gustafson. So as you can see from these slides that we presented from our health rankings, We've done some good stuff. I mean, the partners in our community are working to improve, and some of these you can just see by Dr. Gustafson and the earlier that she just presented in the earlier slides. So planning for our future. What are we going to do to continue to improve? Well, it's not a sprint. This is a marathon. What we do now will impact us in 5-10 years from now. These health rankings and the things that we have won't just change overnight. So everything that we do in little steps working together will make a long-term impact. A lot's been implemented in the last year or two, and more is coming down the road. Our community partners are working hard to improve health across Lake County. The panel members now will briefly highlight current and upcoming projects to improve the health and wellness of the people in this county by what they're doing in their agency. So.
Thank you, Denise. I'm Dan Peterson, CAO for Sutter Lakeside Hospital. It's my pleasure to be here this evening. I just could not be more proud of the work that we've done at Sutter Lakeside in improving the quality of care and improving the services that we offer over the last few years. We have a lot of things we've accomplished, and we intend to continue on this great upward trajectory we're on. Last year, within the Sutter Health System, there's 24 hospitals. We received a dashboard award for our quality and our service as top in the system in terms of quality patient outcomes on a number of statistics that we monitor, things like preventable hospitalizations, readmissions, preventable C-sections, a series of industry standard quality metrics where we've been at the 90th percentile and above in just about all of them. That's better than 90% of hospitals in the country. We were just informed a couple weeks ago we were also awarded that same award in 2018. And so the last couple of years we've done a really great job providing excellent quality. So patients who come to Sutter Lakeside Hospital truly and honestly receive some of the best care that they can receive in the state. We've been really happy with that. We've been recognized for the last 2 years through the government's the Medicare website, Hospital Compare, with a 4-star rating in both quality and service for the last 2 years. We're really excited about that. We've implemented a Smart Start Baby Bundle, which we're proud that actually many partners at the table have also collaborated with us on now, and is really a true collaboration through many of these agencies to help prevent sudden infant death syndrome in the county, by providing the necessary safe sleep materials to basically any mother having a baby in Lake County has access to a variety of safe sleep materials now. We've added a whole range of services at the hospital as well. So I know we talk a lot about there isn't enough specialty care, there isn't enough access to services. Well, we've implemented 4D ultrasound, transesophageal echocardiograms, telepsychiatry, EICU coverage for critical care specialists in the Bay Area now 24/7, helping monitor our ICU patients, telenephrology, telegastroenterology, remote infectious disease coverage, a whole series of new offerings within our hospital that have helped us keep Lake County patients here in Lake County. We did some analysis and found that based on the admission rates that we had and the patient volumes that we had in our emergency room, we were able to keep 400 more inpatients here in our county who otherwise would have had to been flown out to San Francisco, Sacramento, Santa Rosa, something like that in prior years, and provide the care that I mentioned, I feel is some of the best in the state, right here to these patients here in our county so that their loved ones can come and be with them and people can receive the care that they want, where they want it. So we've done a ton. We've had a lot of success in our quality and in the services that we provide, and we intend to continue that over the next few years.
Thank you, Dan. So in public health, in our health services department, we actually have several programs. In the public health department, we have our California Children's Services program, which has implemented the whole child model, serving 425 children with 40 orthopedically handicapped children served by the medical therapy unit, where they receive physical and occupational therapy in order to increase their ability to have a productive and happy life. We provided over 1,000 influenza vaccines. We coordinated the medical services in response during the Mendocino Complex fire, including outbreak control, at shelters. The Medical Reserve Corps, which is involved in volunteer, primarily doctors and nurses, has increased to 80 licensed volunteers, and funding has been secured for communications upgrades. And we increased capacity within our communicable disease program for surveillance and response. Within our public health, the SNAP Ed program, which is nutrition education, we have the Harvest of the Month program, which promotes fruit and vegetable consumption to over 4,000 students and 160 classrooms across 13 schools, from preschool to middle school on a monthly basis. We partner with school gardens across the county, providing materials and health education expertise. We provide health education at a number of community events, including brochures and interactive food demonstrations. We serve on a number of school wellness policy councils, providing nutrition and physical activity education expertise. And within our tobacco prevention and education program, we built have a robust youth coalition group at high schools. Currently, 75 active members are involved at 4 different schools. We have coalition trainings, including tobacco industry targeting youth, health risks of tobacco, secondhand smoke, and tobacco pollution. The Youth Coalition planned outreach events such as Kick Butts Day, Earth Day, World No Tobacco Day. The Youth Coalition is currently involved in a community awareness project called Photo Voice, which documents the retail environment regarding tobacco products, advertising, and promotion to be displayed throughout the county. And finally, in our environmental health program, we provided support to the Emergency Operations Center during the Pawnee and Mendocino Complex fire, including safety inspections at shelters and safety assessments with the state and county departments in the fire areas. Environmental Health completed the federally sponsored wildfire hazardous and household hazardous waste cleanup program from the Mendocino Complex fire, and they successfully completed the state-sponsored wildfire debris removal cleanup for the Pawnee fire. They were successful in completing the local area management program draft for the on-site wastewater treatment system for the land use program. And they successfully implemented the local agency program called the LEA for solid waste management.
Thank you, Erin. Again, I'm Crystal Marketan. I'm the Director for Social Services. I think when I looked at the presentation earlier, we really do fit within the scope of health and community wellness of Lake County. The department provides a variety of programs, most of which you probably are familiar with. I'm going to highlight a couple right now. May is CalFresh Awareness Month, and Lake County Social Services recognizes the need to reduce hunger by increasing participation in food assistance benefits, particularly for the elderly, disabled, families, and children. And CalFresh is California's version of the Supplemental Nutrition Assistance Program, or SNAP, known federally. Currently, 11,237 individuals are enrolled in CalFresh in Lake County. With more than 64,000 people residing here, it is estimated that only about 2/3 of those eligible are receiving CalFresh. Many households may be unaware that they qualify. Just as an example, a family of 4 making up to $4,184 a month may still be eligible for CalFresh. Coming next month, well, actually in June, is CalFresh expansion. And over 3,600 seniors and disabled SSI recipients in Lake County may be newly eligible for CalFresh benefits. SSI recipients can start pre-applying on May 1st, and if eligible, would start receiving benefits no earlier than June 1st. Current CalFresh households with an SSI household member do not need to apply. The changes will be applied to the case in the next periodic report, or if you want the benefits sooner, you can go in and apply. And actually, there is no requirement for an office visit. You can do this all online. There's some flyers in the back that guide you through the process if you're not familiar with accessing services online related to eligibility. After the application is filed, the interview is completed by the telephone, and documents are submitted online by mail or by mail. Most applications are decided within 30 days, sooner if eligible for expedited services. CalFresh recipients choose and purchase their own food from grocers using an EBT card, which works much like an ATM card. So again, if you are interested, you can either call the department or access the flyer on the back table. So one of the programs under Department of Social Services is the Area Agency on Aging for Lake and Mendocino counties. The services that are provided are for health. There are specific services, that are provided for the health and wellness of aging residents. And those are ensuring healthy, well-balanced meals for seniors in a congregate setting or delivered to their home. So that's at the senior centers throughout the county and in Mendocino County, and then through Meals on Wheels. Also providing education around healthy eating, exercise, fall prevention, and diabetes awareness and prevention. Supporting family caregivers by providing education, training, and respite, and hosting low-impact exercise to seniors at senior centers through group Tai Chi. Another one of the programs in under social services is child welfare services. And this program is where you commonly think that children placed in out-of-home care, in foster care, are living here in Lake County, and that is not the case in over 60% of the cases. We do not have enough households that take children in. They're now referred to as resource family homes as opposed to foster homes, but we are recruiting to move children back into Lake County, so we're recruiting homes for that. Last year, we were able to approve 14 additional resource homes in the county, bringing us to a total of 26, which is still inadequate, but we're still working on it. If you're at all interested, you can call Child Welfare Services. Recruitment and retention efforts for resource family homes continue as child well-being is directly linked to maintaining important ongoing connections in their community with their families, schools, churches, and friends, and it absolutely has an impact on how the rest of their life goes. And so it is a really strong goal of ours to recruit those homes and get Lake County kids back in Lake County. Also, I just want to mention a program that is new to us this year. It is the Housing Assistance Program through CalWorks. Assists CalWorks families to quickly obtain housing for an initial 6 months, or in some cases up to a year. HSP houses families with a Housing First methodology, which houses families regardless of ability to pay, past conviction history, sobriety, or other barriers, while providing wraparound supports to foster housing retention. You do obviously have to be eligible to CalWorks. This fiscal year, Lake County Department of Social Services has received $290,000 in funding, which will house up to 25 families. We currently are contracting with NCO, North Coast Opportunities, which I am conveniently sitting next to Robin here, to administer the program, and those interested should contact their CalWorks caseworker. Robin?
Thank you, Crystal. Hi, everyone. I'm Robin Barra, Director of Community Programs for North Coast Opportunities. If you don't know what NCO does, we are the Community Action Agency for Lake County. That means that we're tasked with serving the most vulnerable people in our community, so we create programs and initiatives to support those people with the collaboration of all these folks you see up here. So one of those programs is the New Digs Rapid Rehousing Program, and that program provides financial assistance and case management support to those in need of housing or at risk of becoming homeless. We currently serve 14 clients. However, a new partnership is underway with social services, and we expect to double that caseload within the next few months. Again, following that housing first model that we believe people need to have access to permanent housing first. And once we secure that, we can help refer them to community-based supports and help them work on their other needs. We also currently are employing disaster case managers. So even though there are no fires burning right now, thankfully, we are still in the long-term recovery phase of disaster case management, and long-term recovery basically means that we're helping folks rebuild homes. So through a partnership with the Cal Home Loan Program and Hope City, we are able to offer low-interest loans and low-cost volunteer rebuilds for those who were uninsured and lost their home in any of the fires. To date, we have rebuilt, through a partnership with Hope City, over 20 homes, and we are continuing to build them at this very moment. We have given over 1,000 individuals disaster relief funds, gas cards, Target gift cards, things like that. Over $151,000 was administered for households directly for housing needs through our Unmet Needs Committee. And we also were able to open a disaster recovery assistance donation center. So for the 6 months following the most recent fire, we had a donation center in Lakeport where folks could come get toothbrushes and diapers and whatever else they might need. Another of our programs is the Gardens Project, Lake County. Gardens provide a way for community members to meet in a shared space to learn about and access local and nutritious food. The Garden Project works with local government and private landowners to lease underutilized land around low-income neighborhoods for the creation of new community gardens. So we build gardens, we teach folks how to manage and maintain those gardens so they can eat healthy and nutritious food during the gardening season. Recently, our most recent garden was here, right in Middletown at Calpine, and we are working on one now at Hospice over in Lakeport. The Volunteer Network is one of our larger programs in Lake County and has a variety of programs. Just to touch on a couple of them, a really fun one is the Foster Grandparent Program. So we find foster grandparents in the community and we partner them with a youth working with the Lake County schools. Our foster grandparents are mostly volunteer, but they receive a small stipend and they mentor the youth throughout their school years, although many of our grandparents say it's the youth that mentors them. We currently have 12 grandparents in several of our Lake County schools. Schools of Hope is a tutoring program where we work with some of the elementary schools, and the kids who need a little extra help reading are partnered with the tutor, and we currently are in 4 schools in Lake County. We also support Meals on Wheels through financial support and volunteerism. And the VITA program is a really impactful program in Lake County, also under the Volunteer Network. That stands for Volunteer Income Tax Assistance. So in collaboration with United Way Wine Country, we prepare taxes for free for qualifying individuals. So this tax season, we prepared 500 taxes for households in Lake County, saving each person or each household a minimum of $300 in tax prep. And that's money that people are able to spend right back here in our community. We also have our Head Start programs, and many of you are probably familiar with that. We have 4 sites here in Lake County, and Head Start, of course, provides early childhood education, health, and nutrition to low-income families. And perhaps our largest program in Lake County is Rural Communities Child Care. At their core, they provide child care referrals to families, to certified child care providers in Lake County, but they do a whole lot more than that. They also subsidize child care payments for eligible families who are working in school or training or looking for work. In the last year, the program subsidized 363 children's monthly child care services at an average of $456 per child per month. They believe deeply in promoting good nutrition, so they also reimburse family child care providers who provide nutritious and healthy snacks and meals. They have reimbursed $18,000 a month to 30 providers serving 360 families in the community. So all of those kids are able to get healthy meals at their child care. NCO does a whole lot in our community, and that's just a little snapshot of some of the things we're really proud of right now. To Todd.
Wow, you've all been a very tough act to follow. Todd, Metcalfe, Behavioral Services. You might be wondering, why is Behavioral Services here? But studies have shown, and we have seen, that addressing mental illness and substance use disorder contributes to overall health and wellness. So I just kind of put together a little laundry list of things that we've been working on over the last year or so, and things that we're working towards. One of our biggest accomplishments lately was effective January 1st, we took over administration of the Lake County Housing Continuum of Care, which is a coalition that addresses homelessness and housing in the county. And when I took on this role, I'm thinking, what does housing have to do with the clients we serve? But Crystal at Social Services touched on it. Housing first. We got to get these people housed because they won't respond to treatment and services unless they're in a stable housing environment. So I'm excited to be a part of this coalition, and stay tuned for more. We were recently awarded a $600,000 grant through FEMA for the Cal Hope program. Some of you may have heard about it. It's to offer crisis counseling outreach in the county to those affected by the recent wildfires. And we're contracting with Lake Family Resource Center to provide those services, and so they're doing a great job with that. We also just received a $75,000 technical assistance grant to help us apply for housing grants, including the upcoming $500,000 No Place Like Home grant, which will be a non-competitive grant, which should be kind of a slam dunk for us to get. Again, it's all around housing. We were also just recently awarded a $200,000 grant to help folks that are mentally ill dealing with homelessness issues. We're hoping to somehow funnel those monies into the housing continuum of care to beef up efforts there, because it does apply to the same homeless population. We're participating in Hope Rising's Innovation Summit coming up in June. That'll be focusing on resiliency and housing. You're kind of seeing a theme here about the housing thing. It's exciting to be a part of it. We're partnering with Denise, Public Health Services, in an opioid research grant to provide more education to the community about the opioid crisis in our community. Also, our department just recently began offering evening substance abuse disorder treatment services to youth in our Lucerne clinic. We're also thinking about trying to open up our services to evening hours, because folks work during the day. We're only open 8 to 5, so thankfully, there's not a lot of staff in the audience that's going to quote me on that. Also, I'm glad we're here in Middletown, because we're going to be expanding our services here in Middletown. We're closing in on office space here to open what we call a peer support center, which will just be kind of a casual drop-in center to get referrals to our services. So we are excited about that. Also, this fiscal year, we created a $500,000 housing reserve account just to sort of hopefully funnel into the housing activities that our department is working on. We've also been an active partner in the Safe RX Coalition. So pretty much we're just doing our best to support, collaborate, cooperate with all the activities that are going on. And it was so exciting to hear about all the things you guys are doing, and I can't wait to hear more about what's on down the table. But we're here to support it, we're here to help, and I'm just grateful to be on this panel, and thank you for asking me to be here, Denise.
Thank you,
Next. Oh, you already did your thing.
Give me a mic now.
Uh-oh.
Go ahead. You'd like me to go? Yeah.
Check. Very good, thank you. My name is Russ Purdock. I'm the Director of Community Integration at Adventist Health Clear Lake, and it's a pleasure to be here this evening with this amazing panel. I got to say that working collaboratively with this group, we see each other often, many times actually through the week at different meetings. So thank you all very much for having me, and I'll get to work with some of the amazing things that have been happening and some of the wins we've had at Adventist Health. First, we have to transition. We have to look back to the future, so to speak, in rebranding a hospital and then building trust within our community. I think that's one of the things that our new president and CEO, Mr. Santos, has been able to do very effectively. And building that trust within a community and getting our scores up has been, frankly, just very significant and a wonderful part to be a part of. We're the second best quality and safety score in 2018 for 1,300 critical access hospitals across the country. Very proud of that. We have more specialty and surgical services than ever before, including eye, ENT, general surgery, cardiology, GYN, ortho-maxillofacial surgery, dentistry, urology, and orthopedics, hopefully coming later this summer. And then moving into one of the things that I was actually just excited to be a part of. I served on the Clear Lake City Council for a time and got to work with our Senator Mike McGuire in kind of that groundwork he started with No Place Like Home that was referenced earlier. And through that, we were able to actually start Project Restoration, learning how to break down those silos. We're learning how to work better together collaboratively, because we found that we were all dealing with the same high utilizers and we weren't spending our money effectively. So out of that sprung Community Wellness about 3 years ago, a program that was started at Adventist Health Clear Lake. And again, from working from the outside, it was very exciting to watch the collaboration that happened with County Behavioral Health, with Sutter Health, Lake County Health. It has just been fantastic to watch. So out of that, we created Restoration House. Very proud to be a part of Restoration House, and happy to report that today I just learned we were accepting our 40th client. These are people who were formerly homeless. They needed respite care. They had complex medical needs. And through Project Restoration, we're able to, rather than help them, to heal them, but then have to turn them back out on the street. Obviously, there's failures there, and they end up back in our emergency department or our clinics. So by opening Project Restoration, we're able to help them to heal, and then I'm proud to say we're able to work with NCO in getting them housed, and we've been able to house several of our clients. One particular win was a lady who was able to actually, with the funding we were able to create through our social services program as part of Restoration House, actually was able to buy her own home. So pretty big wins there. We're really excited to be a part of that. Through that, it's awesome to work with Alison. And I want to also recognize Shelley Trumbo, who had a lot to do with the creation and vision for Hope Rising. And also Marianne Taylor, who her grant writing skills was able to find funding, and also Marilyn Wakefield, able to find funding to get those programs off the ground. Take a breath here. SafeRx has been a fantastic program. It was mentioned a little earlier. That is a program, again, focused on prevention, but also in the reduction of opioid use. Susan DeSalvo Reed, an RN and member of our community, South County community specifically, is able to go around to many providers and reduce the number of medications that were prescribed so they weren't abused, so they weren't sold on the street, and creating to a bigger problem of opioid addiction and opioid abuse. Of course, we recognize that when you squeeze that proverbial balloon, there's going to be an impact on the other side, and we expected that. We've seen an increase in some of the street IV drugs, but we're working with a couple of our 3 providers at Adventist Health Clear Lake through our medically assisted treatment program and trying to get more people into treatment to recover from that terrible disease. We're proud to say that we've been working with some of our folks who've been doing needle exchange for many years, but trying to reduce what has been identified in the upper 90th decile as IV-related infectious diseases, and trying to reduce that through needle exchange. We also started a Leave It Behind program. Leave It Behind is a program where we find folks that are, or families or their friends who associate with opioid users, and we can, with a 2 to 3 minute training, show them how to use Narcan, naloxone. And with that amazing drug, they're able to reverse the effects of an opioid overdose to then get them into EMS, get them into our emergency department so they can get into treatment, hopefully recover, and another avenue into our medically assisted treatment program. And then we've been doing youth prevention programs for opioid reduction. One of our amazing AmeriCorps Vistas hosted a youth dance, and at that youth dance we had several speakers there, 3 speakers, that were able to share with the youth that were present the dangers and their personal testimonies of what opioid addiction had done to them. Next, we're proud to be a part of the American Red Cross Resiliency Grant. We've all been impacted by the fires. It's been devastating for the last numerous 5 years that I can think of, where we've had a major fire event in the county, and our children and our families have been impacted by that. Melissa Grebe is a strong member of our team and has been going out, and the work we've been doing with Lake County Office of Ed that Brock will probably touch on, to try to teach resilience to our youth and overcoming these big impacts. And again, with Lake County Behavioral Health, we're proud to partner with them. Other wins that I'd like to report. We are soon to be the proud owner of a shower trailer. one of the biggest things I think that happens in our unsheltered communities and populations is the fact that they have no way to clean themselves, to have better hygiene, and we're very excited to receive. So our builder tells us in May, we're hopefully by the mid-May area, we'll receive a shower trailer that we will move around to different communities throughout the week, allowing folks to take a shower. But along with that, we have an office space within that trailer where we can conduct intake interviews, where we can find what they need and better serve that population to try to transition them from hopelessness and homelessness into housing. So we're very excited to see the great work that Mr. Metcalfe is doing with behavioral health and the other social services that are here in the county to try to get people into housing. Another part of the fire, of course, is the fact that our housing inventory has been so dramatically devastated. So this is a big piece. And one of the other things that we've found is because housing has become such a problem in our county that people are being priced out of housing. So by no means of their own, they're finding themselves homeless. Again, just really quick, we're proud to say that we were part of the gala event where we were able to donate, raise $100,000 and then donate that to the city of Clear Lake, trying to build community and have some safe playground equipment for our children to play on. I'm sorry, just trying to get everything in. Well, I'll leave it there. We're proud to be a part of the Every 15-Minute program here at Middletown High School, as we are about, I think, at almost three times the national average for alcohol abuse and alcohol death. So we really needed to get our hand around that. I thank you for letting me go over time, and I'll pass the mic.
Good evening. My name is Carla Ritz. I'm the Executive Director for First 5 of Lake County. First 5 is not a direct provider of services. We fund services in the community that benefit children prenatally through age 5. And we have several First 5 commissioners here tonight. If you wouldn't mind just raising your hands. 1, 2, 3, 4 out of 9. We are frequently networking throughout the community to make sure we are filling gaps for young children. The health of our community, as you know, begins with the health and well-being of our youngest children. There is a powerful, persistent, direct correlation between the number of adverse childhood experiences, or ACEs, that a person endures during their childhood and the increased chances of poor outcomes later in life, including a dramatic increased risk of heart disease, diabetes, obesity, depression, substance abuse, smoking, poor academic achievement, time out of work, and even early death. Some of us in this room today or listening on Facebook are coping with costly health conditions that had their roots in the way that our bodies and brains had to adapt to endure difficulties in our childhood. So health truly begins at the earliest age. The bottom line is that what happens in childhood doesn't stay in childhood. And because of this reality, and because 90% of a person's brain is developed by the time they're 5 years old, preserving and improving the health and well-being of Lake County's youngest children is a rock-solid investment in improving the health and well-being of our entire county. So we are trying our best to invest in things that make a big difference. Some of the things that we are investing in are programs that are being run by people in this room. I want to just give a shout out to Anna Santana, who's the director of Healthy Start, and she's also sitting on the Upper Lake School Board right now. And she oversees several programs that we fund. One of those is Nurturing Parenting. These are parenting classes offered around the lake for free. And they also include dinner and free childcare, and there's no reason not to go. Good parents make healthy kids, and that's a huge benefit for our community, so enroll in those. As was mentioned earlier, Sutter Lakeside Hospital started the Smart Start Safe Sleep Baby Bundle program a couple of years ago, and Adventist Health joined on board, and so now any baby born or any mom pregnant, you don't even have to deliver. I know a lot of folks in Middletown deliver outside of the county. So even if you're planning to deliver in St. Helena or somewhere else, you can attend a safe sleep class at either hospital and receive a whole host of wonderful items that you would get at a baby shower to start your baby's life off on a good foot. But you also get connected to community resources. So parents need to know what's available. You've heard just this much of what's available in our county tonight, and you're probably overwhelmed and can't take it in. And so we start very early and very practically by showing up at these classes and saying, this is what's available to you now that you're a mom, or you're a dad, or you're a partner. One of the other things we invest in is the Imagination Library, which provides free books mailed to every child in Lake County who registers between the age of birth and their 5th birthday. So this is encouraging parents to spend time with their children and exposing children to many words. We're also investing in improving quality of childcare in our county through the Quality Rating and Improvement System. This is a very large undertaking that Lake County Office of Education is providing, and First Five is helping to fund, where we are providing coaching to child care providers all around the county who want to improve the quality of care that they're giving to kids. These are sometimes women or men in their homes who are just overseeing a few children, all the way up to large centers where they serve many, many children. So if you're interested in that, please get in touch with LCOE. Easter Seals, we are helping them to fund early learning centers on both sides of the lake. So there are playrooms where parents can bring their children 0 to 5 to play, interact with other children, and find out what's developmentally appropriate so we can catch delays early. They're also providing ages and stages questionnaires to our pediatricians in the community. So if you haven't received one of those and you have a child or a grandchild who's between 0 and 5, that's something to ask about. Those are readily available. Lastly, I'll just mention we have many other things, and you can find them at first5lake.org. That's spelled out, the number 5, first5lake.org. But one last thing I'd like to mention is a program funded by Department of Behavioral Health called Motherwise. And that is for the intense purpose of preventing and supporting those with postpartum depression or perinatal mood and anxiety disorders. So it's trying to connect moms to the help they need. There's a home visiting program, there's weekly groups, there's a lending closet, there's a Facebook group, there's all sorts of support there. So many opportunities. Stay tuned later this year for the results of a State of the Children project that many community stakeholders are joining together to work on, and a call to action that's going to involve everyone in our county to identify and embrace the part that we naturally play in improving the lives and outcomes of our children. Thank you.
Hi, I'm Brock Falkenberg, Lake County Superintendent of Schools. And I just want to remind you that since the 50s, schools have provided instruction in fitness, wellness, nutrition, and since the 80s, they've added tobacco use prevention and education. We call that TUPE. When you get to the upper grade levels, we continue our focus on education by addressing drug and alcohol awareness, sexual health, and most recently, human trafficking awareness. And if you're not aware, Lake County is a prime target for young men and young women to be trafficked or lured into the sex industry. So I'm quite proud that we have started that initiative in the last year or two. We're 1 hour into this listening session and we're still talking. So I'm going to cut my presentation as short as I can here. We have made a great effort to focus on kindergarten readiness. Carla has already addressed most of those efforts, focused on kindergarten readiness, or many of those efforts anyways. Our school districts have focused on school gardens and introducing the farm to school effort into our school lunches, having local produce available for all of our children. Additionally, I have to address Healthy Start and the efforts of the Lake County Office of Education in supporting case management efforts amongst our youth and our students in particular to overcome obstacles in their lives or their families' lives related to health or other issues that prevent them from success in school. And so Healthy Start continues to be one of 2 Healthy Start programs that continue to function in this county. And we do so largely because of support from other agencies in this county, local agencies in this county. Adventist Health, along with Konocti Unified School District, a couple of years ago, opened a health clinic right on one of our high school campuses. And that's available to the community, but it's a primary asset to the students in that particular community, as well as any other community. A great effort has been put forth in focusing on school attendance. And if you're not aware, we talk about our health indicators. We're not doing so well. We're not doing so well in school attendance either. But over the years, last few years, our attendance rates have started to improve, and our graduation rates have started to improve. And both of those are indicators of a growing, vibrant, economic, and well community. I mentioned several of these things, but I'd be remiss if I didn't mention that none of these things are possible without a collaborative partnership of everyone up at this table, as well as many agencies that are not here tonight. So I'd like to make sure I thank each and every one of you for all of those efforts. Most recently, I have applied for and I've been named as the finalist to sit on the board of the School-Based Health Alliance. And my goal in that is to bring resources to rural and remote areas of California to support student health as well as children's health. All of the other efforts that the School-Based Health Alliance have been focused in have been in urban and suburban areas, so we're really hoping to bring more resources to Lake County as a remote and rural community. Thank you.
Hi, I'm going to spare you all from hearing my speech a second time around, so I'm going to pass the mic.
And Brock, you made the best point I've heard all night, is that we're an hour into this and we're still talking. So I'm going to wrap it up. And as I've listened to the panelists, I'm thinking, what could I possibly add to this incredible array of things going on in here in Lake County? And the one I haven't heard mentioned is the silver tsunami that's impacting the United States and Lake County in particular. And I want to speak to that for just a moment. I've had the good fortune of serving for many years on the governing board of the local area agency on aging, and that program serves seniors here in Lake County, and it is a woefully underfunded program. Per capita, Lake County has a much higher rate of seniors. It's in the low 20% range of seniors age 65 and over. I imagine that is primarily due to the fact that it's more affordable to live in our area than it is in many other areas. And the simple fact is, the silver tsunami, with the baby boomers aging out, the population of seniors in America is going to double over the next 25 years. So the number of folks over 65 is going to double. The Area Agency on Aging program primarily funds the local senior meals that are served in senior centers and taken out in home delivery, Meals on Wheels programs. And as I said earlier, it is woefully underfunded. The trends do not show any growth in that area. You hear lots about funding opportunities for housing and homelessness and other needs in communities, but not so much about seniors. And given Lake County's unique demographics, I think we would be remiss if we didn't also touch on the needs of seniors and the need to focus on securing more funding to serve them here in our rural community. And I'm particularly grateful that one of our forums is going to be hosted at a Clear Lake Senior Center and during earlier hours of the day. So we're looking forward to hearing from seniors in all areas. So thank you.
All right, well, I just want to say thank you to all of our panelists. I'm so happy that you all came out to give the public some information and on Facebook. So before I turn it over to Elise Jones, who's going to go through some questions with the public, I do want to make there's a commitment sheet back in the back. We're asking everyone to take one. And this is just a commitment for things that you or your family are going to do to be healthier. And you write it on one half, and you take the other half for yourself and put it up on your fridge or your desk or whatever, and start taking one step, one little thing that can make a difference in your life or your family's life or your community. So at this point, I'm going to turn it over to Elise Jones, who's our accreditation coordinator here at Public Health, who's going to walk you through just a couple questions, and we're going to open up the mic. So each question, we want you to come up and tell us what you think. If you don't like to speak at the mic, that's okay. We have addresses in here for our email at both the health department, Hope Rising, and the county visioning site, so that you can email us or you can give us a call and you can talk to us further about it. All right, so I'm going to turn it over to Elise. Turn it on.
Hello. Thank you for coming out. Certainly we're blessed to have our panel here tonight, but the real honor is to have you all and for us to hear from the community. So without any ado, what do you think the people of Lake County need to live healthier lives? And if you don't want to come up here, I can bring the mic to you. Anybody have a thought about what people in this county need to live healthier lives? And I will be kind of a timekeeper in the effort to make sure everybody has a fair say, about 2-3 minutes.
I'll keep it quick. Thank you, my dear. Hi, I'm Bernadette Sproul. I live here in Middletown, but I work in Santa Rosa. One of the nice things about seeing things that happen here in the county and also in Sonoma County or Napa or whatever is being able to see some of the things that are offered, especially post-fire. And I just wanted to talk really quickly about something that I was able to experience firsthand and I thought was really good. Can you hear me? So Sonoma had a grant and they invited the community at large, and it was a pretty targeted invitation to a lot of people involved in nonprofits. And what they did is they brought in the Center for Mind-Body Medicine, and they offered a workshop for about 300 people to go through a training on helping to help with trauma, with post-trauma. And then once we went through that, they invited people who were very interested to be trained. And so it was a way to engage the community at large and bring people in to actually help their neighborhood, their community with post-trauma after fires. And so, you know, I'm so happy. It's so wonderful to see this type of collaborative thing that's happening. I work at a nonprofit as well, and that's the way this is going to work, is when we work together. But one of the things that I'd really love to see is how to engage the community and train people within the community to be able to help each other as well. So that's one of the things that I'd like to say, and I'll email some more information about these. And I'd also be happy to help volunteer in terms of grant writing or anything like that.
Thank you. Thank you.
I also want to say that there's an email. If folks want to email in, there's an email at the back. It's our public health email, or you can also email Hope Rising. And if you have any questions, or even tonight if you're here and you don't like speaking in public, that's totally fine. Email and somebody will get back to you about that. Anybody else? Thank you, my dear, for coming up. What can we do? Are we going to move on? Okay. What do you think is the most important thing we can do to help improve your health and your family's health in the next 1 to 3 years? So this is more short term. What's one or two of the most important things we can do? Do we do it all? It's good. We just keep doing what we're doing.
That's going to change because of all the different work that's being done right now. But I know it's just really difficult for Lake County residents, a lot of Lake County residents, to actually have the free time to become involved and participate and create a healthy, thriving, community. I know that a lot of people are doing a lot of good work, a lot of the Rotary and all of that kind of thing. But how do we get just the average, everyday person to get involved and, participate?
Thank you. Community engagement.
Anyone else? She's walking around with it. It's your opportunity.
Don't be afraid.
We want to hear from you. Okay, we'll move on.
Oh, yes, my dear.
Hi, my name is Jackie Felber. I worked with Lake Family Resource Center for 5 years and have engaged with many of your agencies. So thank you for being here and all you do. During the time I worked with Lake Family, I taught nutrition classes, some stop smoking classes, a few health and education. I worked with the homeless. And one of the things that I noticed is with the homeless, I felt that maybe they could be, as you said, more involvement in their own healing practices. I really appreciate that house you're putting together. I really feel that amongst that community, there's not a lot of pride. They need to be able to do something. I saw a church one time that put together a housing project, and what they did was anybody that came in had to take part in some small way. They had like a little thrift store, and people worked, and they ironed, and they mended, and they recycled, and they helped in the kitchen, whatever. Just a community for them. Because we are a community, and by getting together, I think having the involvement with people within helps a lot. Anyway, thank you.
Thank you. A couple of brave folks. What do you like about the healthcare system or systems in Lake County? We've heard Adventist and Sutter talk a lot about innovations over the past couple of years, so now, is there anything that you particularly liked or a good experience you had or you'd like to see more of? And it could be about our clinics too. We have a few clinics in our county. You don't want to? You don't have to, I won't force you. I just like the clinics participate in community events that bring the services basically to the community, where sometimes the community is not able to go to the clinics, but getting it to them on the weekend is always more friendly or more fun, as opposed to, oh my gosh, I'm scared after the clinic, I'm going to sick or whatever. So I enjoy that all of the clinics always participate. So that outreach and engagement piece of our healthcare providers going out there. Okay. So Anna was saying she enjoys, and if I get this wrong, I'm paraphrasing, my dear, when the community, healthcare providers in general, I think, are out in the community and at events and offering things that are outside the typical range of services when they're doing engagement, and maybe also when they offer services that are outside traditional hours. Is that what I'm hearing? Okay. Did I really get it right? Okay. Yes, my dear.
As a parent of a child with special needs, I heard a lot of the healthcare providers talk about services being brought to the county, which I think is amazing as far as specialty care, but I would like to see pediatric specialty care here. Every 5 weeks I'm trucking to UCSF with my son, and I know that I have the resources available to do that, but there's a lot of parents in this community that don't have those resources, and I feel that that's something we need to focus on.
Thank you. Anything else you like about, well, we moved on to what needs improvement as well, so if there's anything you like or anything you think that needs improvement, what would you like to see come to Lake County in terms of healthcare?
Yeah, absolutely. Our panelists can respond to
Yes.
any of the questions, so.
Thank you, sir. Thank you very much for your question. I'd like to respond to the lady in front about Restoration House. One of the things that we did there is we actually tried to get our residents, once they're healing and in that transitional process, we actually find jobs for them. Hope Harbor was something, because we have such short time, where we had several of our residents actually serving in the warming center in Lakeport, which was very beneficial for them. And they also are going out of the community and finding work, which helps them, to better transition, better heal. So thank you very much for your question.
Do either hospital want to address the question about pediatric specialty care?
So I know that actually Lakeview Clinic is here in the room as well, and I'd like to acknowledge they've recently brought a new pediatrician to town who we've been working to help support as well, and been trying to partner with on that. So there are pediatricians coming to town. I'm actually I'll be going tomorrow. One of the difficulties with some of the specialty care, right, is A, attracting and recruiting the specialists, and then B, having a sizable enough volume for some of the subspecialty stuff to be able to support a subspecialist. One of the things we'd like to do to solve some of those problems is increase the use of telehealth. I believe that that's what we'll be seeing more and more of in the future, especially in rural communities like this, to be able to provide access to this subspecialty care, at least to a greater degree, in communities that may not have the population base to support that in and of itself. And I'll be going tomorrow in front of the state legislature to testify in support of a new assembly bill that's being proposed, AB 744, to support more robust payment models for telehealth, which will help make it much more accessible for our communities. So I think that working with our state legislators and working with government officials, I think we'll see much more of that in the future. I say that as a parent of a son. My son, when he was like a year and a half old, had a gastrointestinal issue, and we had to do the same thing. We had to drive down to San Francisco for visits that could have happened via a video. I mean, there's nothing special. I understand maybe having to go down for a procedure, but for some of the routine visits, there's no reason that couldn't have happened via telehealth. And I think that that's going to be a big part of our solution in the future as well.
Thank you, Dan. Okay. Anyone else? Okay.
Did I see him?
I would just, I don't know, this may be way in the future, but trauma center. Because trauma, people are flown out, they don't have reach, you get billed for that lovely $60,000 bill. So I don't know how much in the future that is, but a trauma center would be something that I would love to see happen in our county. For car accident, I mean, we have trauma in our county, I know that. Thank you.
Any comments from our panel about a trauma center?
Yeah, I'll say, sorry, I can't see you back there, but so at Sutter Lakeside, we are a level 4 trauma center. Unfortunately, that does not allow us a broad range of trauma activations, but we have done a lot. It costs us a lot of money to do that, to be designated as a trauma center. It's a very laborious process, and there are a lot of requirements that go with that, which we cannot utilize very frequently, because again, as a level 4 trauma center, that doesn't enable us to do a lot of the really common heavy traumas. But we do that because we find so much value in the training that's associated with that requirement. We find that it helps our staff be much better prepared for the things that do come in, because inevitably we do have to, as a rural location, we do have to occasionally deal with stuff that you'd be much better equipped at a huge teaching hospital somewhere, but just the nature of the situation is someone may not make it that far, and we have to do what we can. And so we find a lot of value in even just being a level 4 trauma center, in the training that gives to our staff and the preparedness that gives them. Having said that, we do continue to look at the requirements to increase the certification levels. They are very difficult. It's very onerous just to be a level 4 trauma center, but we do continuously assess, and we'll continue to reassess. Maybe could we move up to level 3 at some point in the future. I can't promise you that, I'm sorry, but we do look at that because it's a service we'd love to be able to provide for our community if we can at some point.
Thanks, Dan.
Any other thoughts? We can move on to our next question. So, yes.
To build an acute care facility in the near future.
Acute care facility in the near future. Anyone?
Can you repeat that? Acute care, like
Are there any plans to build an acute care facility in our county?
An acute care hospital?
Are you talking about an urgent care facility? An urgent care.
Oh, an urgent care. Thank you. We don't at this time. It's very expensive for a hospital to build something like that out. Not that I'm saying we won't, but it would require probably $5 or $6 million at least to do that. Having said that, that's not off the table. That's something we continue to look at as well. In the meantime, what we've done within our own clinics, for example, at Sutter Lakeside, is we recognize, not everyone wants to go to the emergency room for everything. We want to have an alternative, and so we've implemented an advanced access program in our clinics where we reserve patient appointment slots ahead of time or up until the date of service, and we don't open them up in advance because we reserve them for urgent patient appointments. So that if a patient calls in the morning, and this is for our established patients, but if a patient calls in the morning and has an urgent need and doesn't necessarily feel they need to go to the emergency room, we can get them in that same day to be able to see them in a more cost-effective manner. So we've tried to kind of create a proxy for an urgent care center because we don't have an actual urgent care center there right now.
Does Adventist want to?
That was Sutter, yeah.
Yeah, that was Sutter. Does it, Adventist, do you have, I don't know what David went.
Thank you. I just want to thank Mr. Peterson for that. Absolutely, we're looking at that. One of the things that we are really interested in doing is to be able to provide those services that will keep our families, our residents here in Lake County by the services we're able to provide. Again, an orthopedic, cardiac, all these different things that we could really use. Again, the problem I think that we find is being a small community, 64,000 people, it's difficult. It's difficult to get the funding for those programs. But a great question, and yes, we are keeping an eye on that. One of the things that have come up is the access to clinics, the access to medical care for preventative medicine instead of showing up at the EDs when you're in crisis. And we're trying to open that up at Adventist Health as well to be more accessible. Finding providers, as Mr. Peterson pointed out, is difficult. It's difficult to recruit, attract, and then retain those providers, such as pediatrics and those. But we're doing our best. Thank you.
Thank you both. Thank you guys for the questions. The next question that we have for you is, what can you, as a community or an individual, do to help your neighbors in your community be a healthier place to live, work, and play? What are some individual things you can do to make this community healthier?
And I'm going to interject here just a little bit. This is kind of what the cards are for as well, is to look at this exact question. And then if you don't have a plan, you create a plan, you write it down, because then it becomes a goal, and when it's a goal, you can make a plan, you can accomplish it. So take your papers and think about this question and give us your input right now, but take it with you and just do one thing, one small thing to make a difference.
Well, I was just going to say things that, most people do are, with gardening, do a neighborhood garden. Find out what neighbors, you can take walks with. Offer to help walk your neighbor's dog, do it together with other people, and have kids over, invite kids over to have, their sports games or whatnot. Just be available, really.
And of course, you do have the papers, so again, if you're shy, you don't want to talk in the mic, and you can email us. People who are Facebook Live streaming can always email us as well, any of these questions or questions that they have, and we'll be sure to connect those dots for you. Yes, ma'am. You don't have to. I'll paraphrase.
Bring them food. We have many patients, dementia patients in our town alone. We don't have groups for that. We don't have a lot brought to that. I feel like in our community, it's so important to be with the kids, but it's even more important because their time is so valuable right now to be with the elderly of our community and walk, gardening, spend time, do puzzles, talk to them, just do their laundry, something that they can't do even. They would enjoy you being there to do those things. So I think that's important in our community.
Thank
Should
you.
I paraphrase that, or did everybody hear?
Do we have a program for that?
If I may,
Please.
again, I was so appreciative to start working at the Adventist Health in November of this year, or in 2018. So bear with me. But since going to work there, one of the things that I really wanted to focus on as new programs that we want to invest is to speak for those who really have no voice, and that would be our very young children and then our seniors. As recently as last Saturday, I was able to meet with the senior community center director in Lucerne at Alpine Lucerne Center, and I've also met with the Oaks Senior Center Director, Clear Lake, and here in Middletown. One of the things that we've found across the board are issues with transportation, issues with nutrition, and issues with programming dealing with mobility. So as we're beginning to look at a program to dig down and see what kind of strategies can be created to scaffold up something with either grant funding or to work more collaboratively with our senior programs, something that we would like to have a robust program that we could actually take out into the entire county. But those are exactly what we're looking for is programs that will help support our seniors, because building community makes for a healthier community. If we can get these folks away from the TV, if we can get them out either in doing exercise classes at home in their chair, if they're not able to come out, these kind of programs have proven to improve the health of our community, our seniors in our community. So real simple things that may have a big impact. So thank you very much for the question.
I'd like to just add to that, Todd Metcalfe from Behavioral Services. We fund Canocti Senior Support's Friendly Visitor Program, and someone mentioned earlier about volunteering. I mean, it's a volunteer-based program. Before I came to Behavioral Services, I came from a background of working with older adults. I hear exactly what you're saying, but it's what someone said back there before, it's community engagement, getting people involved, but volunteerism is really where it's at, because the funding isn't there, as Carol mentioned. It's just not there. So it is getting the community involved and helping these folks and getting engaged.
Thank you.
Yes.
You had mentioned the program where you had the seniors that come to read for the children, which I think is a great program. And we also have the program where the kids have to have so many community service hours. It would be great to have some kind of a group to have those two sides of the spectrum helping each other. I think it's great to have a mentor system, and I think some of the schools have that in place, do they? Where some of the older kids work with some of the younger kids. I know my brother was very hyperactive when he was younger, and his teacher used to have him go into the younger grades and work with the students. It did so much for his self-esteem and really helped the younger kids. And we could do something like that if we had the kids working with the adults and vice versa, obviously supervised to some degree, but it would be great to have some sort of incentive volunteer program for that.
I want to quickly interject that I facilitated in partnership with our community health assessment some focus groups, and that issue also came up. It's not a surprise, right? And one of the framing that came out of that was it's not just about kids or anybody going out to our seniors and giving something for them. Our seniors also have a lot to offer us in terms of their knowledge and their wisdom. So I think the fact that you're touching on that there's a relationship there is really critical. You want to say something?
Anything else? Okay, this is your opportunity now to ask the panelists any last questions before we wrap up. We want to be respectful of your time. It's now 8 o'clock.
Denise, can I make one mention?
Absolutely.
Too? And then just to talk about seniors, this weekend, the Senior Summit will be here in this event center. So please pass the word, April 27th. I think it's 8:30. 10 to 3. Is it 10 to 3? All right, 10 to 3. They must have wanted me here early or something. So 10 to 3, right here in this room. I think this is the second or third annual but it is something that is critical in our communities. Obviously, as a Board of Supervisors, make sure to support the March for Meals program. Not only support it, also walk when I can. I wasn't able to do it this year because of an event that I had something else scheduled, but also deliver the meals. The physical and the mental interaction that you get with the folks are most needy in the community are just beneficial. You should volunteer and do that. Every year here in South Lake County, I've done Hidden Valley, done the Middletown route, and there are some very unique individuals that we have living with us. Some history for many different generations right here in our community. So it is very important, and it is very rewarding also to get out there and help. And I will elaborate on the kids volunteering at the senior center. There are kids that are volunteering. I know that the high school signs off on their programs for serving lunches, doing their dinners and their other events. And I know they have one coming up again this month, the chili cook-off, and kids will be working that event and helping them at least raise their money. So I know slowly but surely we're getting there. What I love about today, sorry Denise, now I'm dragging it on, they gave me a mic, is that, you know, I've heard it many times today, but, you know, coming from my tribal background, you're sitting on our ancestral lands that we have for the Middletown Rancheria. You take care of your children, you take care of your elderly and the most needy folks in your community, and you'll be stronger for that. And what I see here, everybody at this board, I want to thank them for all the hard work from the county, all of our county partners, and all of our private business sector partners here, is that this community and this county is really starting to move in that direction. And even though those were horrible tragedies that started in 2015 with the Valley Fire, I think it really reignited the fire and the people for caring about their neighbors and the opportunities we're going to bring here in the next decade. So I know I'm excited about it, but I really want to thank everybody here tonight for doing what they do, because I do get to witness all of that out in the community or point people in the right direction. So thank you very much.
Thank you for hosting us tonight. So to wrap up, next steps, the Community Health Needs Assessment report will be done in the next month or so. After that, we'll have the Community Health Improvement Plan. We'll be doing work groups around the county to identify top health priorities. The community visioning forums will continue in the other 4 districts, and we'll have a central location for information, and that will be at the Hope Rising website and the County Health Department. There are 4 more events coming to Lake County in the District 2, 3, 4, and 5. If somebody couldn't make it here tonight, please get the word out to them that you don't have to be in Middletown, you know, just here. You can go to Clear Lake, you can go to Lakeport, you can go to any of them. It doesn't matter if that's your hometown or not. Show up and hear your voice. And then to contact us. If you think of something, which happens a lot after these, you think of something tonight or tomorrow, or you start chatting with your friends or your family, here are our contact information. Please contact any of the departments that you see up here, and we will get that information and we'll get back out to you and make sure it gets on the list, or we'll answer any questions that come our way. And I want to thank Supervisor Simon for hosting us here tonight, and all of the panelists. Thank you for coming out. And more importantly, I want to thank the public. We can't do this without you. We need to hear from you. We need to hear your voice. We need to hear what's important to you. So thank you.